11 minutes. Hey! Come on, you told me. Oh. So there is this. Hi, babe. You're welcome to the ATJ podcast. I think this is the first time my fans will be seeing you live and direct, like us doing something together. Welcome to the ATJ podcast. I am Oluwatobi Bukwade, well known as ATJ. I speak about freedom, life, this, and everything in between. And today, I want to have a conversation with my husband on the screen. So there is this subject, baby, that has been making around on social media. An influencer, I don't know, maybe an influencer. Is she an influencer or a celebrity? I would not classify as a celebrity anyway, maybe an influencer. Maybe it's I don't know, whatever you want to call the person. Yeah, has been talking about having cancer, like breast cancer. But then there is a bit of disparity in information, like inconsistency. So I have a few questions to even ask you. First, as a doctor, you're a specialist in internal medicine, and I know that you've dealt with a lot of counted number of patients that have the same diagnosis this person is claiming to have in terms of different types, maybe liver cancer and all those things, like acute patient. I know you deal with patients with acute medical problem, so intense as cancer and all those things. So first and foremost, is it possible for someone to claim to be in stage 4 cancer and be that active as granting interviews and all of that?
Well, the truth of the matter remains that stage 4 cancer is an advanced cancer.
Yeah.
So, talking about breast cancer, definitely for someone like that to be in stage 4 cancer, okay, note, I'm not invalidating anybody's truth. I'm not trying to throw anything out of the window, you get.
Yeah.
So, but stage 4 cancer is actually a big statement to make. So, it's an audacious statement to make. So, so basically for stage 4 cancer, you are expecting a lot of metastasis, So, metastasis means, the tumor cells are already they are infiltrating other organs, So basically for a breast cancer of stage 4, you're expecting to have metastasis in the bone, in the liver, in the brain, and other part of the bodies of the body. So basically, and so in the lungs as well, the person may be having intense cough, loss of weight. The person would already have lost a lot of weight, so it will be cachectic,
But you said something in the morning when I asked you offline, something. You said a stage 4 cancer patient can be active.
Yeah, definitely. A stage 4 cancer patient could still be active, but most likely the person has to be under therapy that is trying to suppress the cancer.
And this person has never started chemotherapy or anything, any treatment.
I don't know if she has started.
Yeah, she said it.
She said, okay.
Yeah, on Arise TV.
So, but definitely it's not a curative therapy. It's just a palliative therapy. And, at that point, it's just to be able to prolong the lifespan. And life expectancy. So, but yeah, the thing is, if the person is under therapy, it's possible the person could still be able to do daily activities, even though they are still going to be restricted because they will be undergoing chronic fatigue and everything. And talking about the diagnosis, well, I saw a lot of, with the Arise TV stuff you showed me this morning. So there were a lot of off statements that are off in our stories. So.
Like how they came about the diagnosis. But I have a bias about the fact that sometimes she said she went to a private clinic as a patient. So I think I have had a first-hand experience of the Nigerian medical system as a patient. And you know that I was wrongly diagnosed in Nigeria. This. So do you think that there could be that possibility of her being wrongly diagnosed without further investigation? Or do you think they didn't do their DJ? In Nigeria, especially a private hospital, the doctor in charge or the owner of the hospital might actually be specialized in one thing, but because of money, they will carry other things and join body.
So
do you get? So they might not. Maybe the person is not well knowledgeable about cancer and just probably give advice. Do you think there could be that possibility?
Okay, so the thing is, even though I've not, officially worked in Nigeria, so, but of course I have quite a number of experience on what goes on in the medical system in Nigeria. So the thing is, most people in private practices in Nigeria, many of them are general practitioners. So the medical system in Nigeria is like, you need to know a little bit of everything. So, but a little bit of many things. I mean, many of these general practitioners, they are more in general medicine. So basically what they do is mostly internal medicine, but they have idea of, general surgery and what to do with oncology, but they are not oncologists. Many of them are not oncologists. So, I mean, it's very hard for you to even find a position to do residency training as an oncologist in Nigeria. It's really not easy to even do residency training. So the thing is, if she's claiming that she went to a private, hospital, I don't want to believe that the person she met there is an oncologist. You won't just see an oncologist like that. Many of them are in teaching hospitals, university clinics, and all these things. So the point is that what was up for me is that, okay, she said give her a local anesthetics, and then they did an incision and everything. Biopsy. Well, biopsy is not done that way. So
she said that it was done. Yeah.
So she said that's the method.
And you said something that biopsy without imaging. That they don't do biopsy without imaging
so
first.
For somebody that, basically the major symptom of any kind of cancer majorly is the person starts to get, the person has fatigue, loss of weight, massive loss of weight within a short time.
She didn't look like she lost weight anyway.
So massive loss of weight, say the person has lost 20 kilograms within 10 days.
Wow.
So
that's massive.
Massive loss of weight, fatigue, lack of appetite, fever, sweating at night, all those things, they are called B symptoms in medicine. So basically, basically, when someone comes to you like that, so the first thing you want to do is you want to either do a mammography and you want to do an ultrasound, So after that, you are having of course you want to do physical examination first. You want to press the lump, you want to examine the lumps, you want to see what's going on. Then you do a mammography or ultrasound. So when you have a suspected breast cancer, you go for a biopsy. Biopsy is, there is a special kind of instrument which looks gun-like. And it's a fine needle. It has a fine needle, a specialized kind of needle. And basically it's going to be, the region is going to be numb, but we look at local anesthetics. Then, it's going to be like it's under ultrasound guided or mammography guided. So basically the tumor tissues, the tumor cells will be extracted and sent to the lab, which could take like 1 week before the result comes out. But making an incision to say,
well, maybe a lot of people, so even though there are some inconsistency in the information the person gave, I want to believe that some people don't really have that that intellectual capacity to capture things fast, because I just kind of think that maybe she just probably did not remember what was done or something.
So the point is, I'm not trying to invalidate anybody's anyway. I'm not trying to. The thing is, we are trying to examine the possibility of being true, which is even not our own problem.
And this is for education purpose. This is to educate the public. That's why we are having this conversation.
Basically, it's not our problem.
It's not. The gist is not really. This isn't the gist to educate.
It's about public education to know what it is like. And basically, cancer is not something that you want to wish on yourself.
Of course.
So basically,
so saying that cancer is not what anyone would want to wish on themselves takes me to the mental health disorder part, because when this started, I have been, because I do research like mental health, trauma. I'm in the mental health research trauma field, and there is so something crossed my mind when I started hearing that okay, all this might not be true, and I'm like, and people started asking the question, why would somebody wish for this kind of thing? And I'm like, okay, you know, in Nigeria, mental health is not a thing. You know, Nigeria don't really believe in mental health, and this kind of took me back to factitious disorder, where someone can fake an acute illness.
Yeah, you can in factitious disorder. The person can fake a wish to have
not really wish, but then fake it, pretend to have it, or even inflict if they are caregivers to like maybe a child, maybe like a mother taking care of a child, or maybe a caregiver taking care of an adult, like they're in care of somebody, just to draw attention to themselves. They can fake it on that person. They can exaggerate symptoms, you know, anything that would draw attention. And those kind of people, you'll be so shocked that the people living with this mental health disorder, they can envy someone getting attention, maybe being caregiver, like being a mom or a parent, to like having someone they're kind of like that is depending on them, that they're caring for. They can even fake or exaggerate pain for that person so they can get the attention. Because when a child is sick, the parents get the attention. When an elderly person is sick, the caregiver get the attention. So they can, even if they can't inflict it on themselves, they can try to, if they can't fake it on themselves, they can fake it on someone else that will attract attention to them. So you'll be so shocked to know that the people living with this mental health disorder, they get jealous of sick people or people that get attention, even though the attention is not pleasant. Like maybe someone has an accident and the person's leg got amputated, they can be jealous and be wishing for that because of the attention the person is getting.
Yeah, it's a mental
health disorder that I kind of feel like they should look into. Instead of castigating this person, you can actually look at that. Because cancer is not funny.
Okay, so
it's not funny. Like, why would? So I think instead of canceling her and making her feel like, I feel like this is also a call for awareness for Nigerians to also pay attention to mental health disorder in Nigeria. Like, it's not a thing. They don't pay attention to it, and I think and I think mental health could also be a factor. This factitious disorder could also be a factor to what this person is experiencing.
Yeah, so the thing is, with this also, we are not saying that this is it.
Yeah.
You know? We are just trying to talk about the possibility that this could also be possible if, for example, she's actually not having cancer.
Yeah.
We don't know.
Yeah, we don't know. We're not judging.
So we didn't see.
And if she does, we're praying healing for her.
We are just trying to, educate the public and, trying to look and think outside the box. Okay, is this possible? Is this possible? Is this not possible? And so basically, we are not saying she doesn't have what she's claiming to have. If she has it, good luck to her. We
pray healing for her.
So in terms of this factitious disorder, so
but they want people an identity, empathy. They want to attract
pity, identity, people to see them, they want to be seen. So it could be because tell me why the video of so I'm loved, so people don't want me to die. That video that was making round on social media recently. So everything is possible.
Yeah,
so
it is possible. And Nigerians. So the wrong thing is that this may actually be mental health disorder that Nigerians are not paying, or the person the person in question is also ignoring. We are made to believe in Nigeria that psychiatric only insane people see the psychiatrist or need the psychiatrist. So that is what Nigeria has made us believe, and that's not true. So you can hear our baby's cry. So we gotta go. Happy Sunday and happy Easter. Bye.